As we all know, we're seeing rising case counts here in our community as we are across the nation. And we wanted to have this gathering today for the public to ask us questions about the vaccine. We do want to see an increased uptake in vaccines. We know vaccines work. We know vaccines are the way out of this, but we also know people have a lot of questions. So we definitely want to answer your questions today. So we've assembled a panel of experts. We have with us Dr. Jean Marie Mayer. She's the hospital epidemiologist for University of Utah Health for our hospitals and clinics. We have Dr. Andrew Pavia, the chief of the Division of Pediatric Infectious Diseases at University of Utah Health. And we have Dr. Tori Metz, an associate professor of obstetrics and gynecology. She's also a maternal fetal medicine specialist and vice chair of research for obstetrics and gynecology at University of Utah Health. And we will have someone putting everyone's spellings and titles in the chat for any media who are joining us today. So I'm just going to get started with you, Dr. Mayer. Can you give us a snapshot of, first, let's talk about what we're seeing in our community, and then tell us what we're seeing in our hospitals.
Thanks, Kathy. Yeah, so I think everybody's aware that across the nation, we're seeing just rising rates of COVID, and that's what we're also seeing in Utah. In Utah, we had cases that really had sort of plateaued and were at a lower level during the spring. And over the last several weeks, we're just seeing increasing numbers. Our cases are really doubling. The cases that are occurring across the state, when we look at our hospital numbers, we were at low levels of patients hospitalized with COVID at University Hospital. We were down to, maybe only 5 or 6 patients in the hospital. And over the last couple of weeks, we're starting to max out, and we're in the neighborhood of more like 30 to 40 patients every day in our hospital. I think this is something that, and as we are across the nation, our rates within the state of Utah are now at high rates of transmission of COVID, where our percentage positivity, when we look at person over person, it's like 15% of all individuals being tested or positive with COVID.
Okay.
I would also say that the other thing that's important to note as well is what we are tending to see now is younger people getting infected with COVID. So previously, when this all started, say last year, we were having more issues with individuals hospitalized who were older. Now we're seeing more and more younger individuals, so more even 25 to 35-year-olds being hospitalized, and then more middle-aged group rather than those that were elderly. And I know that Dr. Pavia can speak to what they're seeing at Primary Children's Hospital as well, starting to see more children being hospitalized.
Dr. Mayer, can you just clarify that point? We're seeing more younger people. Is that because of the Delta variant, or because they're more likely to be unvaccinated? Why are we seeing younger people?
Yeah, that's a great question, Kathy. So I think probably a combination of both. In terms of you're much less likely to become infected if you have been vaccinated. And we know that the older age groups in our state are vaccinated. So those individuals who are unvaccinated have a much higher chance of being infected with COVID. We were on a call with the health department earlier today, and you're at least 4 times less likely to be infected if you've been vaccinated. And we know that in our age groups, our younger age groups in Utah, that there's just a less of an uptake of vaccination. And I think the other thing that we just know that Delta variant is so much more contagious and infectious. And I think along with that, over the summer, we've had, there's people are just doing more, people are out together at events. There's less masking. So there's a more contagious virus, and people are out there and doing more things and mixing with one another. So I think it's a combination of everything.
Kathy, if I can add to that, when we last talked, we didn't really know whether Delta was causing more severe disease or more hospitalizations. But there have been 3 studies, one from Scotland, one from the UK, one from Ontario, that have come out in the last few days that suggest that Delta is in fact causing more hospitalizations and more severe disease. And I think that's reflected in what we're seeing in young people and children as well.
Okay, thanks, Dr. Pavia. And I'm going to get to you in a minute. We're going to talk about school issues, and Dr. Metz, we're going to talk about pregnancy, but I have a couple questions first for you, Dr. Mayer, that are coming in. So we have a really interesting one here. We have someone who's saying their family tested positive for COVID in December and they're recovered. They're worried about getting the vaccine. They're reading about inflammatory reactions, and they're wondering, what are reactions from people who've had COVID to the vaccine? And is there natural immunity? So those who have had COVID, do they still need to get the vaccine? And so can you touch on those questions?
Yeah, that's a great few questions in there. So I would say that what we know is that the vaccine provides broader protection than natural infection. So it's broader immunity, and it's felt to have more prolonged duration than natural infection. It's still recommended that people that were previously infected go ahead and do receive the vaccine. And there are some individuals that, for example, with long hauler syndrome, it's felt that many of those individuals actually improve after they've been vaccinated. So my recommendation would be, if you previously had natural infection, that you go ahead and get vaccinated.
And to clarify, Dr. Mayer, natural immunity only lasts, we're saying usually roughly 90 days. And then I've also heard, and maybe you can clarify this for us, that people who've had COVID and get vaccinated actually get a better immune response.
Correct.
Is that correct?
Correct. So it's unclear with reinfections, how long, what's the duration of protection you have from natural immunity if you've previously actually been infected with the SARS-CoV-2 virus. What we do know is that vaccination provides longer protection and broader protection. So as individuals are exposed to newer variants, there's better protection from the vaccine than there is with natural infection.
Okay, and then we do have a question about mandates. Should Utah look to mandates? So I do want to be clear here today. Our role here as physicians and researchers, we supply our elected officials with valid scientific and medical information for them to make the decision. So we're not necessarily going to be weighing in on what we think policy should be here today, but we're going to talk about what we think are sound medical practices. So when we're talking about vaccines, what do you all think about incentives and mandates? Do you think those things help? I'm going to give that to you, Dr. Pavia.
Yeah, so, we did a series of surveys and some focus groups as part of the HERO project. And that incentives were not really something that people said would motivate them a great deal. But what came up a lot was that getting vaccinated for many people is difficult and expensive. They were worried that they would have to take time off from work to go get vaccinated. And they were worried that they might miss a day if they had some aches and pains or ran a fever the day after vaccination. So, I don't have the answer for that, but I think what can help a lot of people is to come up with ways to make it affordable and more practical for them to get vaccinated. And that may mean time paid off, or that may mean a little bit of a compensation for the time they might lose.
Okay, and thanks, Dr. Pavia. I have a question for you, Dr. Metz. So we have someone who's saying, can we get a better answer than just, yes, you should get it while you're pregnant? Why? and is it safer? Why is it safer for pregnant women? And so this person is saying, we're hearing do it, but why? Tell us why.
Yeah, I think that's a great question. And I'm not surprised that there's a question about this. I think early on, we were a little bit conservative about this. We weren't really sure because pregnant patients had not been in the initial trials, but some things have changed since then, and we have a lot more information now about vaccination and pregnancy. So much so that, the American College of OBGYNs and the Society for Maternal Fetal Medicine, who take care of all, the physicians involved in those studies take care of all the pregnant women in the United States, are really recommending that pregnant women be vaccinated now. And that's not just a shift in the way we think about it, it's a shift in the data that we have. So we have a lot more information now that the CDC has collected as women have decided to give them information as they've been vaccinated during pregnancy about their pregnancy outcomes, about side effects. And what we're seeing is that, vaccination really is safe in pregnancy, and it is as effective in pregnancy as it is in non-pregnant individuals, which was another question that had come up. I think, why to do it in pregnancy specifically, it's really the issue of pregnant women are vulnerable when they're pregnant, in that when they get infections, they tend to get sicker than people who are not pregnant. And that happens with flu. We are definitely also seeing that happen with COVID, that pregnant women who get COVID are sicker than those who get it outside of pregnancy. And so that's why there's such a push to say, pregnant women are at higher risk, and we know that this vaccine is safe and effective in pregnancy. And so we really want pregnant women to be getting vaccinated. There's also benefits to the baby, and that's something that I think a lot of patients consider as well, is that, when we get vaccinated, when we're pregnant, we have an antibody response to that vaccination. So we make antibodies, and that's what protects us against that virus. Those antibodies also cross the placenta and go to benefit the baby, so that when the baby's born, before the baby would be able to get any kind of vaccinations, the mom's antibodies that were made can protect that baby in that really vulnerable neonatal period. So it's an opportunity for pregnant moms not to just protect themselves, but also to protect their baby.
Okay, and Dr. Metz, I have a couple follow-ups for you. So let's try and do a little rapid fire round with you today. So is the vaccine safe for all stages of pregnancy, all terms?
Yes, we can give it anytime during pregnancy is safe.
Okay, and this question here, I believe, is related to pregnancy of the percentage of women, and this says 90%. I don't know if that's a correct figure, but of those who have not been vaccinated, what is the percentage of those who have already had the virus? Is that something that you know the answer to?
We don't know the answer to how many have already had the virus, and that's why they don't get vaccinated in pregnancy, but we do know that the vaccination rates in pregnancy are very low, which is very concerning to obstetricians, and why I wanted to come here today and answer questions that people have or any concerns that you have. So hopefully I can address it and help you feel safe doing it.
And do we have evidence that the vaccine won't affect an unborn child and won't affect fertility?
Yeah, I mean, I think there are definitely data out there now that say that the vaccination does not result in pregnancy complications. I think that it's also important to think about how these vaccines work, and they're really working right there in that muscle where that vaccine is given. It is not something where the components of the vaccine are crossing the placenta or going to the baby in any way. The only thing that's going to the baby is that protection that your body is generating to help protect the baby. But there's no reason to think that there would be any harm to baby. And I think initially that was the message. We kind of said there's no reason to think that would be true. Now we actually have the data to back that up and say that we really are not seeing any increased risk of complications when people are getting vaccinated in pregnancy.
Okay, and one more question for you, Dr. Metz. We have someone here who says they're 40 years old, they're 32 weeks pregnant with an IVF baby, and they're nervous about getting the vaccine since their pregnancy is so high risk. What do you say to this person?
Yeah, I would say I understand the hesitation that we all want to do everything we can that's best for the pregnancy, especially with high-risk pregnancies. I take care of women every day with high-risk pregnancies, and so I do understand that. What I would say is that your risk, if you were to acquire COVID in pregnancy, is much higher than any kind of risk that could possibly be from the vaccination. And so the vaccine really is going to protect you, and getting it in pregnancy also allows you to then pass those antibodies and protect your baby.
Okay, and I'm going to turn to school issues in just a moment, Dr. Pavia, but before we get to that, Dr. Mayer, I'm going to ask you a couple really quick questions. Does the COVID vaccination help fight against the Delta variant?
Yes, the COVID vaccine has been shown to really help decrease infection with all the variants. And we know that it also works with the Delta variant. I think some of the concern that people have or may be hearing is that perhaps it doesn't work as well as it did with the earlier strains, but we do know that it still is, yes, very effective. And the goals of the vaccine are really to reduce severe illness, hospitalization, and death. And that vaccine is still highly effective against the Delta variant.
Great, thanks, Dr. Mayer. Another quick question for you. For those who had Johnson & Johnson, what is the efficacy rate against the Delta variant? And is there a booster on the horizon with Johnson & Johnson?
Again, all the vaccines that we have currently under emergency use authorization in the United States are effective against the Delta variant. We do know that the data that was initially presented with the Pfizer Moderna versus the Johnson & Johnson in terms of preventing symptomatic disease, the mRNA vaccines had a higher clinical efficacy in those clinical trials. But again, in terms of preventing serious disease, hospitalizations, all of them are highly effective.
Okay, and I'm going to turn to you now, Dr. Pavia. Before we get to school issues, though, since you have a background with the CDC, I want to ask you this question. Why is it taking so long to get full FDA approval of the vaccines? Why are we still under this emergency use authorization?
It's a great question, one that lots of people have. Full authorization has a couple of components. So one is to have enough follow-up and safety data, and that was achieved a long time ago. So the FDA has more information that would go towards the safety and efficacy for full licensure for these vaccines than they have for almost any other vaccine when it's licensed. But the rest of the full authorization is a lot of fairly technical and bureaucratic requirements. The companies have to show that their manufacturing plants are clean and effective, that they have a long-term supply chain, all sorts of regulatory requirements. Those are in law. FDA can't speed those up. So people put a lot of attention, sort of understandably, on the fact that it's still under EUA, but it's not for safety or efficacy reasons. It's for very technical regulatory reasons.
Okay, now let's talk a little bit about school, students starting in a few weeks. We're going to talk about masking in a second, but just right out of the gate here, do parents still have enough time to get their kids vaccinated? You can't at this point be fully vaccinated before school starts, at least in most districts, because that's like a 5-week process. But can you talk us through that, and what level of protection will students have if, say, they go out and get vaccinated today?
Yeah, sure. So you start to develop some antibodies about a week after your first dose of vaccine, and those peak at about 2 weeks. And then after the second dose, which is 3 weeks out, in another 2 weeks, you hit sort of maximum levels of protection. So it takes 5 weeks to be fully protected. Against the older strains, one dose did okay. Depending on who you read, 50 to 70% protection. One of the dangerous things about Delta is that a single dose of vaccine doesn't provide much protection. It's only down to about 30%. So, getting started as soon as you can will mean you're fully protected as soon as you can. And until you've hit that second vaccine dose, I think it's important to do other things you can do to protect your child. Have them wear a mask indoors, avoid other very risky situations, maintain social distance.
Okay, so let's talk about masking. There are some questions here about should students wear masks going back to school? In addition to your work as a physician and with the CDC, you've also been in a project, you mentioned it earlier, the Utah Hero study. Do you want to talk a little bit about masking and some of the research that's come out of that? Tell people a little bit about Utah Hero and what that work entailed.
Yeah, so so Heroes was a project that had many different aspects to it, but one important one, led in part by my colleague Adam Hirsch, was looking at ways to understand what was going on in schools with transmission and how to keep schools open safely. Lots of partners involved in that, educators, school administrators, the CDC. But the bottom line of what we learned was that you can keep schools open safely, and we did that successfully in Utah when you have universal masking in the schools, when you do your best to maintain decent distances between students, and then use other measures, ventilation where you can do it, keep groups of students together. So in elementary schools, out of about 50 classrooms that had a student come in with COVID, only 3 had as much as a single another child get infected when masks were worn. So we know that masks in the classroom work. The other things we've learned is that kids tolerate masks. They don't like them. I don't like wearing masks. You don't like wearing masks. But kids do really well, and they don't have a political agenda that masks are taking away their freedom. They understand that it's the way things are done in school, and it really works pretty well. So we know that we can have schools operate in person safely with masking. We also know that from other countries around the world where masking wasn't done, schools can have explosive outbreaks. And we saw that in other studies done in the United States where masking was inconsistent or not enforced. So we know masks work. It's our best tool for the kids who can't be vaccinated. But for the kids who can be vaccinated, vaccine is really the best tool. And one of the, there's not that much good news right now with the spread of Delta. But one of the good news items about Utah is that we're doing a pretty good job of vaccinating our adolescents. About 42.6% of adolescents, that is kids 12 to 18, have had 1 dose of vaccine at least, which actually puts us, it's one of the few things in which we're doing better than the rest of the country. And so I think that's a great start. We've got a ways to go. We'd really like to see, pretty much every adolescent vaccinated, but we're on our way for that. And Kathy, if I'm going to address one other thing that I hear a lot of, and maybe you were going to ask this, one of the reasons that parents are sometimes hesitant to vaccinate their kids is they hear, well, I've heard that kids don't get sick with COVID. It's no big deal. And if you talk to any pediatrician who has been through the last 18 months, they will smack their forehead in pain when they hear that. Because, while it's true that it's much worse to be a 75-year-old than a 16-year-old when you get COVID, there are many, many kids who suffer a lot of consequences. They can be hospitalized, they can die, but more importantly, they can also have long-lasting consequences, which can really impact their life. And we're seeing increased disease burden here in Utah. We had gone for a number of weeks in the spring where there were almost no children with COVID at primary children's. And in the last week, we've had 3 to 7 kids in the hospital, with several in the ICU during that time period. But what we're seeing is not what really scares me. What scares me is what we just heard from colleagues at Arkansas Children's Hospital. It's a children's hospital very much like primary children's, about the same size. Right now, they have 27 children hospitalized with COVID, not because it was found incidentally, but sick with COVID, and 7 in the intensive care unit. And last week, 2 Arkansas children died. Now, I don't mean to be an alarmist, because kids will do okay for the most part. And if your child was diagnosed today, don't panic. But we have a really effective, really safe vaccine. And, as a parent and as a doctor, I've got to say it is the right thing to do for your children. And if we can answer questions that people have that make them reluctant to help them do that, that's really what we're here for.
And before I leave you, with the school topic, at least for the moment, I want to ask you, Dr. Pavia, to really explain the risk-benefit ratio between having COVID versus some of the things people may have heard about related to the vaccine. I know we've heard about a couple, there were a couple isolated incidents with a particular heart condition. So do you want to touch on that briefly and talk about the risk-benefit ratio?
Yeah. So of course, risk-benefit ratio means, what's the risk of not getting vaccinated versus what are the risks from the vaccine. And we have learned that there are a very modest number of cases of inflammation of the tissues around the heart, which is called pericarditis, or of the heart muscle called myocarditis. We've seen a few of these at primary children that are associated with vaccine. We see a lot of cases of it associated with viral infections all the time. The best estimate is that for young adult males, that's something like 8 per million doses of vaccine, which is really, really rare. It's about the chance of getting hit by lightning if you work outdoors in Utah. So, and you compare that to the number of hospitalizations for kids in the same age group, or young adults in the same age group, and you're going to prevent, I don't have the numbers in front of me, but it's something like 20 hospitalizations for every case of myocarditis. And so far, nobody's died of myocarditis. We don't know of anyone who's had permanent heart damage from vaccine-associated myocarditis, but our pediatric cardiology friends at Primary Children's have seen a number of kids with permanent heart damage from getting COVID infection or MIS-C afterwards. So it's a little like, I like to use the example of airbags. Every year, 1 or 2 people get killed by an airbag going off when it shouldn't have, but they save tens of thousands of lives each year. And so because of that, do you want to drive a car with no seatbelts and an airbag, knowing that there is a slight risk to having that airbag on board, but a much, much bigger benefit?
Okay, thanks, Dr. Pavia. Dr. Mayer, I'm really glad someone asked this question. I think it's a really good one. If you've already had COVID and it really wasn't a big deal, why bother?
Kathy, could you repeat the question? The internet cut out.
Sure. This is, if you've already had COVID and it just wasn't a big deal, why should you bother?
Like we said before, previously having COVID gives you some level of protection, and you may have done well with that particular strain that you were exposed to. But as we go through this, we're seeing that there's other virus strains that we could be exposed to, and the next time you may not be so lucky. The other thing I would say is by taking the vaccine, you're not just protecting yourself, but you're protecting others around you. You're protecting your loved ones, your family, other people that you're with. So I would say that if you've had COVID, a natural infection, that the recommendations are that you go ahead and get vaccinated and further protect yourself.
And then do we know if there are any long-term side effects from the vaccine at this point, Dr. Mayer?
So typically, when people have long-term or side effects from a vaccine, you would typically see it within like 6 to 8 weeks. Again, we've had millions and millions of people vaccinated, and we know that, again, the risk of vaccine, it's just so rare compared to the complications from actual COVID infection. And I think there's a much, much higher risk of having long-term consequences of natural infection with COVID than one would from the vaccine. So when we talk about, say, like the long hauler syndrome, that there are studies that suggest maybe about half the people that have COVID may have some long-term consequences of infection with coronavirus. So much, much higher risk of having long-term consequences from natural infection with the SARS-CoV-2 virus than you would from a vaccine. Most issues with the vaccine are very mild, short-term, short-lived, right around the time that individuals are getting vaccinated. And really protects you against the natural infection with SARS-CoV-2. And I would ask people to really think about you're making a choice. You're making a choice between getting a vaccine, one of the vaccines, or you're making a choice of getting infected with SARS-CoV-2 and COVID. And when you're doing your own personal risk benefit, think of that, think of those choices.
Kathy, could I add something to that?
Sure.
One of the most common things people say is, the vaccine hasn't been around long enough. We don't know enough about it. And that's a legitimate thing for people to feel. And that was certainly true in December and January when it first came out. But as of today, 344 million doses have been given in the United States alone. We are following people now who've been vaccinated for about 14 months. And as Dr. Mayer said, most of the side effects are going to show up in the first few weeks. And there are intense efforts to collect all the safety information on the vaccine. So it's no longer new. It's not something that we don't have a lot of data on or don't have a lot of experience on. And while it's understandable to feel that way, at this point, we really know a great deal about it. We may learn more, but we've got a lot of experience and a lot of safety data.
Thanks, Dr. Bethia. And important to point out, mRNA, the technology that gave us this vaccine, that is not new. So I think that's important. The science behind the vaccine, the COVID vaccine is new. The science behind it is not. And one other, two quick points for you, Dr. Mayer, and then I'm going to go back to you, Dr. Metz. One, you talked about long hauler symptoms. That many people who even had mild illness have more serious long hauler side effects. Is that true?
That is true. Folks that really had very mild symptoms, maybe later on can develop really longer term complications that can really be life altering. Chronic fatigue, brain fog, even things like loss of taste and smell, loss of hair. These are all things that may not be life threatening, but can really be impactful in someone's life.
I've been reading a lot about hair loss after COVID. That's an interesting one. And very quickly, before I turn over to Dr. Metz, Dr. Mayer, how do we know when someone has Delta variant?
To know that specifically that if someone actually has Delta variant, we have a great public health lab in our state, and what they are doing is every positive test that we're getting from our various healthcare systems are being sent to our public health lab, and they do genetic sequencing to determine what type of virus strain. So over the last several weeks, we're finding that about 85% of all the isolates that they're sequencing are the Delta variant. So I don't know if each individual would know that did I have the Delta variant or not, but the chances are, the odds are, if you get sick today in Utah, it's very likely it's from the Delta variant.
Okay, thanks, Dr. Mayer. Dr. Metz, a question for you. This person is saying they're seriously considering getting vaccinated, but they're seeing limited evidence regarding lactating mothers and their baby. And they understand that it's been shown that COVID-19 antibodies have been shown to be present in breast milk, which this person would love to pass on to their child. But they're concerned that there's so little information about vaccinated mothers and what they pass on to their babies. Do you have any insight into this?
Yeah, I can speak to that. In general, I'm glad to hear you're thinking about being vaccinated. And I do think that during lactation or while you're breastfeeding is also a great time to be vaccinated for exactly the reason that you're describing. Those antibodies that you make in response to the vaccine do cross via the breast milk to your baby. So you're able to protect your baby that way by antibodies going that way. That's not something that's unique to this particular vaccine. And that's something I perhaps should have emphasized before, maybe a little bit more. I mean, we vaccinate mothers all the time in pregnancy. We vaccinate mothers all the time while they're breastfeeding. And one of the main reasons we do that is because we want this antibody passage to occur both across the placenta and through the breast milk to the baby. And so we do know that among those who are vaccinated, those antibodies are made and they do pass through the breast milk to the baby and offer protection to the baby.
Dr. Metz, do you also want to explain why the vaccine itself can't get across the breast milk to the baby?
Yeah, and I think same thing with the placenta. You know, we are not, the vaccine and the vaccine components absolutely do not cross to the baby directly. You're not vaccinating your baby, you're vaccinating yourself. Your body sees that vaccine and then basically generates a response to that vaccine in the form of antibodies. Those antibodies are then circulating in your bloodstream, and then those can pass both across the placenta via your bloodstream, or they can enter the breast and the breast milk and then be passed to the baby. And you're welcome to jump in too, Dr. Pavia, because I know you're a pediatrician, but from the mom side, that's how I would typically explain it to mothers.
Yeah. And, if you think about it, it's 31,000th of a gram of vaccine. It never leaves either the muscle in your shoulder or the lymph nodes in your armpit or your neck. And it's degraded pretty quickly. There's really no way enough of it can get it doesn't get into the bloodstream to begin with. And there's no way that any significant portion of that could be put into breast milk.
Right. And I mean, I think
pediatricians, we worry a lot when a very young infant's exposed to COVID, and having the mother having been vaccinated and providing antibodies through the breast milk really is very reassuring. We believe it's protective.
Yeah, and I think that's an important piece, is just, this isn't a new idea, right? This is what our bodies are made to do. Moms, see viruses, we get exposed to things. We make antibodies for our babies who can't quite do that yet, or can't get the vaccines yet in the same way that we can. And so it's really an opportunity for us, as mothers and parents, to protect those babies during that really early time period.
Okay, thanks, Dr. Metz. We have a lot of questions here, so I'm going to maybe try and blend a few questions together about mixed messages. We were saying masks on, masks off, now masks are on again. We're telling everybody to get vaccinated, yet we're hearing more and more that vaccinated people can spread, they can transmit COVID, and they can also get COVID and in some cases get sick. Dr. Mayer, I'm going to start with you on this one. Talk to us a little bit about mixed messaging when it comes to masking and vaccinations. Why?
Yeah, I think that's a great question, and I can really understand why there would be confusion about that. I think part of what we've seen is that the virus is changing. So it's not that really the message on masking, it's related to the virus itself. So the Delta variant is just a much more contagious, infectious strain of the virus. And people who are vaccinated still have great protection with that vaccine, but no vaccine is 100%. And with this particular virus strain, the vaccine is not as effective in preventing infection. Much better than without being vaccinated. And again, in those individuals who are vaccinated, much lower risk of getting an infection. But if you do get infected, you likely won't have severe infection. You won't be hospitalized, much lower chance. But what the data, the new current data, where the CDC is really making these newer recommendations, is they find that when people are infected with the Delta strain and they do get infected, that they're shedding a lot of virus. So so they can transmit and make other people ill. So again, getting vaccinated overall still protects others around you, because that individual who's vaccinated is still much less likely to become infected. But if that person does become infected, they can spread that to others. And that's really where the messaging about masking, that until we really have a really high percentage of individuals vaccinated, this is why we're doing everything that we can. We're using all the tools in our toolbox with getting vaccinated, masking, and then, doing some of the physical distancing as well.
So as long as the virus is changing, the messaging is going to keep changing. I think that's probably the bottom line, correct?
Right. And again, I would say that this is something that we look at all the time. I mean, things change over time, and as the information comes in, to change the recommendations based on that changing science. And from what I've heard is that the concern was really a lot of recent data that came out of some transmission clusters and outbreaks that occurred really earlier this month. So really very timely in getting that information out very quickly.
Okay, and I think a couple good questions here. You touched on this earlier, Dr. Pavia, but why should we trust a vaccine that the FDA has not yet fully approved?
I think I touched on that. I mean, there has been extensive experience with 344 million doses. There's up to 14 months of experience with it now. The FDA is just needing to fulfill its legal requirements to check all the boxes on their standards for licensure. But from a safety and efficacy point of view, they could have done that months ago. And we don't know exactly when they'll give the full licensure. Their hands are kind of tied by the law and by the manufacturers giving them some of those details about what country you're going to buy a given raw ingredient from. So really, we should stop talking about full licensure as if it's a magic point at which we know the vaccine is safe. It's just not true.
Okay, and let's talk a little bit about those who feel like natural immunity is better. They're perhaps focused on natural medicines, natural remedies. They feel like maybe the vaccine is putting something, a chemical or something foreign. Can you talk to us a little bit about, and kind of keep this as quick as you can. We want to get as many questions. I know that's a lot for a short answer, but tell us a little bit about mRNA, and is it a chemical? Are these vaccines chemicals and putting something foreign in your body?
This is actually a pretty simple vaccine. It has got very few ingredients. The mRNA is a set of instructions, computer code that your body would make if you saw the virus anyway. And then the body uses it to make proteins, which then let it make antibodies. So this isn't, a whole slew of weird toxic chemicals. It's actually just the message about how to make protective antibodies to protect you from the virus. And, we'd like to think that natural immunity is better. It is for some viruses. For this virus, as much as it changes, we've actually been able to make vaccines which give you better protection than your own body is able to make. And that's true for the other coronaviruses before SARS-CoV-2. They just don't make a great immune response.
When you say computer code, I just want you to be really clear. We are not talking about microchips.
Sorry. Yes, there's no chip, but it's the template. It's the message set that tells your cell how to make a protein.
Okay, and Dr. Mayer, of those we're seeing hospitalized right now, do you know roughly how many of those have been vaccinated versus unvaccinated?
Yes. So I've looked at, for example, at University Hospital, and we're a tertiary care academic center. So we have people getting transferred to us that have more other medical conditions and underlying. So we've had about 300 individuals who have been hospitalized, and about 10% of those have been vaccinated. And I would say that of those, so again, the overwhelming 90% of the individuals who are being hospitalized now at University Hospital, most recently, the overwhelming majority are unvaccinated. And of those individuals who are vaccinated and are hospitalized, 40% of those individuals had severe immunocompromised conditions. So for example, had a transplant. So we know that people that have significant severe immunocompromised states don't respond as well to the vaccine. The feeling is those individuals would likely have benefit from the vaccine, but we don't expect it to be as high as someone with a normal immune system.
Okay, we have a lot of really good questions, and we're starting to run out of time. So I'm just going to ask you guys to keep your questions as quick as possible. And I know that some of these are complicated, and I'm going to give you one, Dr. Pavia. You know, this vaccine seemed really rushed when we've been dealing with HIV/AIDS for over 30 years. Why are we feeling so safe about this vaccine when we have other viruses, you know, that we don't have this kind of technology for? And also, is there any other example of an mRNA vaccine?
So mRNA vaccines have been under research for over 10 years. There are other mRNA vaccines that are in clinical trials right now for flu and for cancer. So it's really exciting technology. Being able to get a vaccine that works this well is a combination of having a virus for which the body can make a good defense and the technology to make a good vaccine. So for HIV, it's just incredibly difficult because HIV's job is to evade the immune system and to destroy the immune system. And that's part of why we've not been able to make a successful vaccine.
Dr. Metz, are there any known complications for from the vaccine for pregnant women?
No, I mean, I can honestly say that we do not know of any complications that would be associated with the vaccine. They have looked at complication rates among pregnant patients who have received the vaccine, and they are the same rates as the general population. So we really are not seeing increased risk at all when people are deciding to get it during pregnancy.
Okay, Dr. Mayer, someone is saying they took the J&J shot and they want to know if boosters do eventually become available. Can they mix and match that with another, like say Pfizer comes out with the booster eventually? Can a J&J person get a Pfizer booster? Do we know?
So we don't know the answer to that. That's being studied right now. And currently we're not allowed to go outside the EUA, but the feeling is that in the future that we most likely will be able to.
Okay, and this Dr. Pavia, I'm going to give this to you. It's asking about when there's emergency authorization given for children 2+ years. What do you think the risks might be? What do you think the timeline is for that? Can you tell us a little bit about that?
Yeah, so we know that the plans are to authorize, well, to submit the data, and if it looks good and if it's safe, to authorize it for 6 to 11-year-olds first, and then to spend more time carefully studying the 2 to 5-year-olds. 2 to 5-year-olds are the least likely to get very sick compared to less than 1 or over 6. So we really are going to spend some extra time figuring out the safety and getting the dose right for that group. Best guess is for that age group is it won't be until sometime around the new year or early next year.
Okay, Dr. Metz, do we know anything about the vaccine, and is it connected in any way to fertility concerns such as PCOS or miscarriage?
I'm glad that somebody asked this because I know that there's been a lot of information about this on social media. I can tell you that there is not any sort of relationship between being vaccinated and having infertility or any concerns at all about fertility following vaccination. Also, if you were to get vaccinated and then you were to get pregnant, please go ahead and proceed with that second dose of vaccination. There's no reason to not do that. We do not see a relationship either between vaccination and miscarriage. It seems to be at baseline rates, no difference between people who are receiving vaccine in the first trimester versus other people. So I think we can be really reassuring about that. There are rumors about that I know are out there, but there's just really no way that this vaccine could affect fertility.
And there's been really good reporting that a lot of these rumors are being maliciously spread by, I think 8 organizations are responsible for most of them. So it's not something that's spreading naturally. It's actually intentional disinformation. But of course, you can't tell that when your friend says, I heard this.
Right.
Okay, a couple other, I want to get to all of these. So let's, Dr. Mayer, very quickly, is the spike protein produced by your own body when you're vaccinated, is it harmful to you?
You mean, so the vaccines that then sort of present to our immune cells the spike protein that then we produce antibodies to? No.
Quick enough. Let's see, we have a question here about, okay, so let's talk a little bit about the Delta variant and boosters when they're going to become available. I think you just touched on this a little bit, Dr. Mayer, about mixing and matching, but I'm just going to throw this out there. What if somebody just said, okay, I'm going to give myself my own booster and I'm going to go over to a vaccine facility and I'm going to say, yeah, give me the vaccine, and they get a third one. What do you say to that?
So what I would say is, at this time it's being studied, and we would like to have the best information available so that we know who are the best individuals to receive the booster and when and what type of booster. So at this time, I think that what we should really be focused and concentrating on is getting as many people vaccinated for the first time, fully vaccinated for the first time. So that should really be our goal. And then when there's more information, boosters will be made available.
It's most likely that the people who are going to need boosters first are people very old, over 80, or people with severe immune system problems. There's really good evidence that out to the duration that we've studied the vaccine so far, in otherwise healthy people, the protection is still holding. Won't hold forever in all likelihood, but it's still holding.
And probably also important to point out that when a booster does become available, it'll be the latest and greatest version that's probably better equipped to deal with the Delta variant rather than the current ones. Is that correct?
Well, that's an open question, because there are studies that compare new and improved vaccines that are fine-tuned for Delta with just getting a third dose. And it would be cheaper and easier if a third dose of the same vaccine worked as well. So we'll see. We just have to do the studies before we know.
Okay, and then I think it's important to address this. Someone's asking about if you gargle with a special mouthwash, can it minimize your exposure to the virus, and can it minimize transmitting it to others? I've also heard about nasal sprays. What do we say to that?
I would say a mask is what the tool that we should be using to prevent transmission.
No evidence of any type of gargle that would protect you. And if you were to gargle with a strong disinfectant for a few minutes, it would reduce the amount of virus in your mouth, but probably not enough to make a difference over time.
Okay, and then someone here is asking, can we mix vaccines when the boosters become available? Immunocompromised folks really want a booster, and we don't really even know if our first vaccine did a good job. Once again, should people try to do their own booster or just really work through their physician on this issue? What do you say to that?
My advice would be to wait. That's a really hot question. It's being worked on very rapidly. ACIP spent a whole afternoon looking at the data. The studies are ongoing. I'd say have patience. You're not going to get left hanging.
Okay, and then
I would also say to that, though, that what an individual can do is make sure they're masked, try to avoid, practice physical distancing, and then ask those around you to get vaccinated.
Okay, and here's a good question. Variants have always been around, the flu, for example, and people have always survived. Why is this so different?
So I guess I'm the closest to an evolutionary biologist we've got here. So, viruses evolve, and they evolve to do what they care about, which is to be spread more easily. Sometimes that results in a more deadly virus. Sometimes it results in a milder virus. We don't always understand why that is, but flu can become much more deadly as it changes. And, the 1918 pandemic killed over 12 million people around the world because it was a new variant that had emerged. And just like Delta, after many variants have come through, has been the worst one so far. Yeah, the virus just managed to evolve from a tabby cat into a tiger. It was never a tabby cat, maybe, a bobcat into a tiger.
Okay. Dr. Metz, this person is asking, their friends got the vaccine and had trouble with their menstrual cycle. Have you heard of this, and what are your thoughts on that?
That is definitely something that's out there, and the NIH has put some has interest in this and is interested in studying this, because we have heard that from women. It is difficult to sort out just based on anecdote. We know that menstrual cycles are affected by a variety of things. One of them is stress. Certainly, we have all been under a lot of stress during this period over this pandemic. And so what is not known is, are we really seeing differences in menstrual cycles that are related to the vaccine specifically, or is it really all of these other factors that are happening? And so it's an area that is actively being studied and that we're trying to find answers to. We know that this is important to women. I would emphasize as well that even the reports that are out there, people talk about maybe one irregular cycle with return to normal after that. And so, this is not something that we think creates any long-term problems. It's not even something that we know is related to the vaccine at this point, but there's definitely interest in from the NIH in studying that, and that's moving forward.
Okay, and we're almost to time here. We have two more questions. I think they're important, so I'm hoping we can all stay on. So this is a question, and I'm just going to summarize it. This person has some numbers that they're giving about deaths related to the vaccine. And so they're saying, how can you boldly declare that the vaccine is safe when people are dying from it? Isn't that dishonest? So what can, Dr. Mayer and Dr. Pavia, what can you tell us about some of the deaths that have been linked to vaccines? Do we know anything about them? And then again, do you want to talk about the comparison of the vaccine versus COVID? Sorry, my lights keep going off here.
Yeah. Do you want me to talk about the safety systems and how they work? So there are no deaths. So any death and any severe illness that occurs after someone's been vaccinated can be, and usually is, reported to the FDA and the CDC, and they're investigated. But to my knowledge, there are no deaths that have been attributed to vaccine whatsoever as a causal, cause and effect link. People die all the time. And, today there will be 40 to 50 Utahns will die of a heart attack. Some of those people were vaccinated in the last 14 days. And so, if you don't look carefully at a comparison of what happens among those who are vaccinated and unvaccinated, you can get the impression that there's a link between them. So to the best of our knowledge in the United States, nobody has died from the vaccine. We can't speak to the rest of the world. And there, because allergic reactions can happen, and if you get your vaccine in a place that can't treat allergy, can't treat anaphylaxis, it is certainly possible that someone has died somewhere in Africa or Latin America of an allergic response that we don't know about. But in the US, we keep a very close eye on all adverse events.
Okay, is that true even of the blood clot issues we were hearing early on with Johnson?
Okay, yes, so I misspoke. So
yeah.
There have been a few deaths associated with the thrombocytopenic thromboses associated with the Johnson & Johnson vaccine. And I don't know the number. The last time I looked, there were 8 under investigation. So 8 out of 344 million doses. It's a big deal if you were one of those 8, but 611,000 Americans have died of COVID. So again, no vaccine is completely safe. because no drug is completely safe, but this is as safe as any vaccine that I know of.
Okay, and I want to point out too, the Johnson & Johnson, we held a press conference a while back with one of our physicians, Dr. Abu Ishmael, who says now we know the warning signs of Johnson & Johnson. We know how to spot it very quickly and we can treat it, and it's usually a kind of a smooth. And I'm sorry, Dr. Mayer, I was interrupting.
I was going to bring up exactly that, Kathy, that now that we know that's a very rare complication, providers and patients can be informed about what symptoms to look for, and if they develop any of those symptoms that rare, that it can be adequate, it can be appropriately treated to avoid death as a complication.
Okay, and last question. This person is saying, you know, because people are still getting COVID with the vaccine, they're still transmitting. Aren't you just saying you're making a choice between getting the virus or getting the virus and the vaccine? I'm going to go ask all three of you to comment on that before we close. So Dr. Mayer, I'm going to start with you.
I would say no, getting the vaccine significantly decreases your chances of getting infected with the virus. And then if you are one of those fewer people that get infected, that you have a very much less risk of getting severe disease and getting hospitalized. So much benefit with getting vaccinated.
Dr. Metz, what are your final thoughts on women, pregnant women, expectant moms, and the vaccine?
Yeah, so I mean, specific to that question, I mean, we know that this virus is associated with complications in pregnancy if you get COVID. So we know that, you know, that results in preterm delivery, that can result in cesarean delivery, that can result in a number of pregnancy complications. We know that the vaccine is not associated with pregnancy complications, and that not only are you protecting yourself, but you're also protecting your fetus and newborn. And so, you know, that's when we weigh these things, and that's when we can say so strongly now that we really do recommend that pregnant patients get vaccinated.
And Dr. Pavia, heading back to school here in a few more weeks, what is your message to families with both 12-year-olds and those younger?
Yeah, it's really important. You know, we need to use all the tools at our disposal. So if you've got kids who are 12 to 18, they should get the vaccine. If everyone in the family is vaccinated, that's some protection. If your kids can't be vaccinated because of age or medical conditions, they really need to wear a mask going to school. But we know that the safest way to go to school is everyone in the classroom wears a mask during indoor classroom activities. Outside on the playground, you don't need to wear a mask. But in the classroom, let's just be able to keep schools open, keep kids in class, and keep them safe.
Well, I want to thank the three of you for being with us today. And I really want to thank everybody who sent in questions. We want to answer all your questions. So we have all sorts of resources on our website. There certainly are a lot of resources with the state. So we really encourage those of you who've been thinking about this, maybe on the fence, to keep asking those questions. We want to make sure you have accurate information. We'll look forward to doing this again in another week or two, but I want to thank everybody for being here today. Dr. Mayer, Dr. Pavia, and Dr. Metz, thank you so much for your time and your expertise. Thank you, everyone.
Thank you.
Thank you. And we're not the only three experts. Talk to your own doctor.
That's right. That's right. Thanks, everybody.